Michele, I am so pleased to welcome you here to the Yerbba podcast. Thank you for being with us today.
Oh, thank you for having me. It's an honor.
Well, I'd love you to introduce yourself and your role and tell us a little bit about your role as a patient advocate as we get started.
Wonderful. Thank you again for the opportunity. It's really a privilege to be here. I am a wife, a stepmother, and a proud grandma of 10 grandchildren. And I'm also a breast cancer survivor. And I have been in remission since the end of my treatment, which is about 2015. So many years out from that. As far as professionally, I worked for 25 years at Blue Cross Blue Shield of Michigan. I worked in the IT department, so I'm very familiar with healthcare and claims processing and how it works in the health insurer, systems. I ran big projects for them for many years. I retired in 2009, and at right around 2013, I started my new work, if you will, as a self-appointed patient advocate, and originally started at University of Michigan, in where I had all of my health care as a patient advisor for several patient and family advisory committees. Right now, I have for the last 5 or 6 years been the co-chair of the University of Michigan Department of Pathology Patient and Family Advisory Council. And it's really been a very rewarding and exciting opportunity that I've enjoyed. I also work for the American Cancer Society as a Reach to Recovery volunteer. And what that means is I meet patients who are going through breast cancer themselves. And I'm a trained volunteer and have been for 6 or 7 years now. I also do a little bit with the American Society for Clinical Pathologists, which we'll talk more about later. An exciting and wonderful opportunity to give back and make some real change. I've also been touched and caregiver to many patients or family members who have been touched by cancer, including my husband, a 2-time melanoma survivor, my stepdaughter who passed away with non-Hodgkin's lymphoma, and several other family members. And so this whole new sort of role for me has come through my own experience and also caring for family members.
Well, thank you so much for telling us about yourself, and also thank you for your service to patients and their families and your leadership in this area. Thank you so much. Your work in pathology really relates well to the title of our podcast today, which is the Cures Act. Can you tell us a little bit about what this act is and what it means?
Absolutely. The law, the Cures Act, was enacted in 2016, many years ago, updated in 2020, and again in 2022. And primarily, and it is a federal, it is a law that our federal government, the Health and Human Services part of the federal government, has worked with Congress to enact this law. And what it essentially does is it prevents health institutions, laboratories from withholding information from patients. And what that means is in real time, you will begin to see, and I'm sure many of your listeners have already noticed, you will be able to see lab results, imaging results, pathology reports, and actually clinical notes from your visits with your providers, not just the after visit summary, but clinical notes. And they'll be posted in near real time to your patient portals out there. And you'll likely receive sort of push notifications on your phone saying new test results are available for you to review. So this is by law what must be done. And unfortunately, sometimes it happens before your ordering physician has had an opportunity to review it. And I know we'll talk more about that later. So while it gives patients access to this information immediately without going through medical records, it is also sometimes posted before the doctor that ordered it had an opportunity to review the results.
So, for people who don't know, what does real time mean? What do you mean when you say that?
Well, I will talk a little bit about an incident that happened to me. It can be as quickly as 5 or 10 minutes. And I'll tell a little bit more about that story later, what happened to me. But it is essentially as soon as for instance, the radiologist reviews your x-ray and writes up their report, it will be posted to your portal. So it's pretty phenomenal. We used to have to, like I said, submit medical records, paperwork in order to get at this information. And now it happens almost immediately.
Is it possible that a report would be available to a patient before it's even been finalized by the pathologist or radiologist, or is it only once the final report is available?
I believe it's only when it's a final report.
Okay, thank you. That's really helpful. So you mentioned this briefly, but what do you see as the good things about the Cures Act for patients and their loved ones?
There are a lot of benefits to the Cures Act. For instance, as I discussed earlier, improved access to the information. It's also very timely access to your results. It enhances your engagement with your providers, family members, and also improves self-care, in my opinion. There is a data integration component to it. The ability to share these reports with other health institutions, other providers has been improved through this act because it's made available electronically to you immediately. It also gives you some sense of autonomy and empowerment because you're able to review the information potentially in the privacy of your own home, the ability to sort of absorb what you're reading, and if you'd like to, do some type of research on your own, develop a list of questions. So it can be very empowering for you and really maybe even give you a little bit of sense of control over something that may seem completely out of, most of us are diagnosed with diseases that we have no control over. And so it might give you back a little bit of that sense of control.
I'm hearing a lot of things in there that are related to information support and preparation. This is what Yerbba does. We try to give high quality information support to people so that they have a sense of ownership over what's happening to them. This brings up the question, what happens with people who don't have access to a portal? People with low vision or people without computer access. There are lots of areas in the United States without access to high quality internet and the ability to use a portal. What are your thoughts about that?
Well, that is really one of my passions right now, trying to increase access. I believe that that is a serious concern. Also, older adults who may not be familiar with the internet. I mean, there's a whole host of issues that are systemic within our healthcare institution, regardless of the portal and the posting of information. So this is a serious concern of mine. And so I've been doing a lot of work in this area because I think that health institutions need to do more outreach directly based upon a patient's preference. In other words, physicians know your patients best. So if you're familiar with your patient and their circumstances, you'll prepare them ahead of time. for instance. You could say, we're ordering a biopsy, and there will be a report that will be available, electronically immediately. My commitment to you is to get back with you within 3 days, or someone from my office will contact you, or something to that effect. So I think that's really important, is the outreach component. And there's a whole host of ways you could accomplish that. But I think that with all of the information we're getting today, fast and furious, I just listened to a news report today about ChatGPT and AI and that sort of thing, and the impact. It's becoming less personalized, virtual visits with doctors during the pandemic. So I think that most of what needs to be done with those in the underserved areas and those who don't have access to the internet is outreach.
Thank you. So outreach, education, it sounds like setting some expectations, being clear with a patient and their family when they might hear from the clinician who's been the one who ordered the test, might get back to them. Sounds like there's some really key takeaways here that we need to be thinking about in the system as a whole, not just for individual patients and families. Thank you for commenting on that. So in addition to the challenges with access, what are some of the downsides of seeing a report, maybe when you're not ready for it, or you don't know what it means, and the person who ordered it isn't available to you? Can you talk through some of those?
Yeah, thank you for that question. I think it's really important. Some of the challenges in reviewing your information prior to your physician seeing it, you can misinterpret the results. There is potentially a emotional response to what you're reviewing, especially when it is an unexpected result or perhaps an abnormal result. A lot of our lab work is flagged, as we know, with red, sort of a red indicator on the report itself. You could focus in on one particular value that may or may not really have an impact on your overall disease or treatment plan, because you don't know the context in which it's taken, but your provider would. So you would have potentially an incomplete understanding, again, a lack of contextual information. All of these things are of concern. And right now, there aren't well advertised, reliable sources for you to go to access information. And we've all seen in this climate what can happen when there's misrepresentation or not as truthful information being posted on the internet and in Facebook and Instagram and all these other Twitter and all these other avenues. So that's a real concern.
So if I'm hearing you right, your concern is that people having a vacuum of information, they get a test result back, they don't know what it means. So they go looking to sources that may not actually be high quality information. Is that what I'm hearing?
Absolutely. And the fact that you as a patient, not being trained medically, might be focusing in on something that really isn't the complete picture as to what the result really means. The findings that are written in many of these reports are written for doctors. And so they can contain very scary words and things that you don't understand, and they may not really present the whole. Your physician may be waiting on additional tests before they know the full picture of what it means for you personally. But as a patient seeing it for the first time, you might focus in on those things and become alarmed. It's very challenging. I used ChatGPT the other day to look at a genetic test that my husband had done. And my goodness, what it returned to me from the findings was even scarier than the findings themselves. So it can be a challenge.
So people not having the information with the whole picture, it sounds like there could be both an intellectual rabbit hole and an emotional response, like you mentioned,
Absolutely.
that people may not be prepared for, like especially if you said an unexpected result or something that, contradicts what people think they're going to hear going into it. And then, of course, not knowing what's clinically significant. So something can be flagged as abnormal when that may not actually have any clinical significance. Without being able to see the whole picture, people can be led astray.
Absolutely.
So, given the advantages of seeing and having access to information, I can totally see the advantages. Given the disadvantages, is it possible that we don't have to look at our reports?
Of course. And looking at the information is not for everyone. And I really think that you need to, if you choose to look at it with sort of blinders on in a way, kind of read it, absorb it, take a moment, breathe, maybe write down some quick questions. Maybe you have to come back to it. But no one is forced to read the information, of course. And if you're more comfortable, wait to hear from your physician. Hopefully your physician will have said to you, we're going to order a test. It may have some concerning information, and hopefully that would be, or if you're concerned about an upcoming test, that it may show something that may be of concern to you. Perhaps you could say to your ordering physician, okay, how soon will it be made available? And if and when it is made available, when will I hear from you? Do you think I should look? So these are some of the things you can get answered prior to perhaps a test that's upcoming that's of concern to you. But you do not have to look. It is not for everyone. And so I would encourage you to do what you're most comfortable with.
That is such helpful guidance. Thank you so much. So, you mentioned earlier that you had a story about your own experience having access to test results. Would you be willing to share about that?
Yes, thank you for that opportunity. As I mentioned, I've been in remission from my breast cancer since the end of my treatment, which was really 2015, a long time ago. But all of last year, I'd been experiencing a great deal of back pain, and it's pretty significant. So initially, my primary care doctor at U of M ordered an X-ray, and that reflected some pretty significant changes in my spine. I do have osteoporosis from my treatment as well. And I learned that I now have scoliosis. So he ordered physical therapy. And I went to physical therapy for a while. And then my gynecologist ordered a bone scan, because people with breast cancer, sometimes if it does come back, it could actually come back in your bones. And she was concerned about the pain I was experiencing. So I had a bone scan in the summer of last year, and it came back good news, no cancer. So I went to therapy, and actually therapy wasn't helping. It was, in my opinion, making it worse.
Mhm.
So my doctor ordered up an MRI. And an MRI of my back was done on December 1st. And the very next day, I went out looking for the results. I got a push notification to my phone. It said, hey, you have new results. I went and looked, and it was extremely disturbing what I read. It said that I had a almost 1-inch bone lesion in my L5, which is part of your spine. And 1 inch, my goodness, and it said it was highly suspicious for based upon my prior diagnosis for metastatic breast cancer. Scared me. That led to 17 days worth of worry and tests and so on and so forth to get to a biopsy of my spine. So one particular day that really points out the real time posting of information was December 6th of last year. I had 2 tests scheduled to prepare me to have that biopsy. of my spine. And the two tests were another MRI, this time with contrast. And then immediately following that, I was to have a PET scan to look for where the cancer was, I guess. So I finished the MRI, and they took me up through the back way through the hospital at U of M, up to the PET scan floor because I had a port in, and the next test required some medication for that. And so they put in the medication, and I was sent back to a room where I was to drink, I call it my PET scan cocktail, for like 45 minutes or so. While I was sitting there, all I had with me was my phone. I received a push notification. It said my MRI results from just 10 or 15 minutes prior were available. So, of course, I started looking. And when I looked at it, I became even more alarmed because they found 2 more spots in my L1 and L4. And here I was, and it said they found something called metastatic foci. And I thought, oh my goodness, what is that? There was no one around. I was scared out of my mind, and I started using, all I had available to me at the time was, I'm going to call it Dr. Google. Of course I looked. I wanted to know, what does metastatic foci mean? And then even more alarming, they had found 2 more spots in my spine. So that's I think a real good example of getting that information. And yet, obviously, I'm very alarmed at what's going on inside of me. Of course, I'm going to look, and then not having anyone around to really ask those types of questions. It was very alarming. So I entered the PET scan highly stressed. The good news for all of your viewers is that I did get to that biopsy. And although the procedure was quite involved, it reported that there was no cancer in that bone lesion that they examined through the biopsy. So I'm happy to report that. And then I could celebrate Christmas.
What's standing out to me is the words that you saw, right? You saw a word suspicious, right? Which has that lurking feeling of danger to me. And then the word metastatic, and then the word foci, or some people might pronounce it foci, Foci. And that just means a focus or an area of. But it sounds as though it was stated as if it were definitive, like this is what it is, or it's possible that's how we read it, right? We don't see that things like cannot rule out. So, to your point that there are words people don't understand, you were alone. You weren't prepared to get that result from the MRI so quickly, would be my guess.
Mm-hmm.
In the old days, you would go into your physician with the PET scan, the MRI, and the biopsy results all at once, and be able to go from these abnormal results to a normal or negative result. What you've described so clearly describes both the pros and, in your case, the cons or disadvantages of that information kind of in your face. Is that what it felt like to you?
Oh, God, yes. And it was, in addition to those words that you mentioned, it was also noted that they found 2 other areas of concern that hadn't been there before. They also found, from what I could read, something on my liver, which it said may or may not have been a cyst. And they also found something in my thyroid. So it was just the whole report, and the findings and all the words they used were, they were just, everything was overwhelming. I don't know. And of course I was stressed out anyway, because I knew the next test was going to really identify where the cancer was. And it felt like going into there that it was everywhere. In fact, when I went in to see them, the technicians, I said, okay, so, and I was really tearful. I was very upset. I said, okay, apparently the cancer is everywhere. Can you please just do a good job and find it, please? It was really horrible.
I'm feeling the emotion right now, many months later, and it's still quite fresh for you.
Yes.
I sometimes joke our scans are so sensitive they find a sneeze before you even have it, and the radiologists are so thorough, right? They describe anything that is out of the sort of perfect result, the negative result. I don't know that I've ever seen a CAT scan that's completely normal. They always find something, even if it is the sneeze that the patient hasn't had yet.
Yeah, that's funny.
So you've made it really clear from your own story, Michele, how having information can be both helpful and it can be harmful, which is, of course, an unintended consequence of the Cures Act. And you've also talked about outreach and information support. What resources do you recommend for patients and families who have access to their test reports, either before or after they've seen their own medical team?
Well, there's several resources that I use on a regular basis and have offered to others. And of course, I will drop I'll plug. I love Yerbba's YouTube channel. I've shared that with many, many patients because, and especially your videos. Sorry, I'm a big fan, Dr. Grace, because
It's mutual, Michele. It's mutual.
well, they're short and you're just really good at sharing information in short bits and not overwhelming people. So I really love that aspect of it. And you cover a wide variety of topics, and I just think that's great. So that is one of my go-tos now, and I share that with others. Another resource that I find very excellent, I kind of stumbled upon it, is called mypathologyreport.ca. And that's all squished together. And what it is it's a website developed by pathologists in Canada. They happen to be in Canada. And also reviewed by patient advisors. I am honored to be one of those patient advisors. So we review all the materials for looking to make sure that the information is clear and concise, but patient friendly. And it gives you, there's a glossary in there. There's the ability to ask questions and receive answers back from a pathologist right through the website, free of charge. And it's a great resource. The other resource that many don't know about actually is reach.cancer.org. And what that is, this is a new app. I had mentioned that I'm an American Cancer Society volunteer in the Reach to Recovery program. And this application, free to anyone, was made available during COVID. And it's really a neat app. What you do is it's for breast cancer patients. So you go in, you set certain parameters, and the app itself will automatically go out and look for a volunteer. You have preset your desire to speak with someone in certain areas, and it will go out and find volunteers, reach volunteers like myself, who would most likely match who you may want to have a conversation with. So it's done automatically, instantaneously, and then you can have a conversation with the Reach volunteer. You can read the profile of the Reach volunteer that it selected for you. It's very cool. You can do it either like text messaging, like texting to the person, or you can schedule a visit with the person. So it's really a great tool. Another obviously trusted site would be anything that the NIH, which is the National Institute of Health, has available for you. And they have a ton of information out there. And you can just go to nih.gov for that. One thing is with regards to scans and so on and so forth, I am also a patient advisor with the American College of Radiology, and they have a great site that you can go to, and you can go into it as a patient, and it will redirect you to other areas or resources regarding scans and also x-rays and that sort of MRIs and that sort of thing. And that's www.acr.org.
Wonderful. What a wealth of resources you've provided to our listeners and our viewers. Thank you so much, Michele. I'd love you to talk for a little bit about your work with health systems and pathologists in particular.
Well, I could talk for days on that, so you may have to cut me off. What's been so exciting for me is advocating for change and really making positive impacts on programs and policies in different health institutions. And through my work with these various organizations, I'm excited to just share with you some of the things as a patient advisor I've been able to change. Through my own health institution, I recently worked with the Office of Patient Experience at my health institution to have links added to the push notification that comes across when new test results are there. So that was really exciting, because that was one of the things I thought was missing. They do send out a disclaimer that says, hey, your test results available, and it may or may not have been reviewed, but then it didn't give you any resources or links to reputable sites. So I was excited to be able to work with them to make that change. Also, the company that makes the portal, they have recognized that this issue of results being posted potentially before your provider has had a chance to look at them. They're adding new functionality, and in the fall of this year, and my own health institution is going to add this, where what will happen is your test result will be made available to you immediately or upon finalization, and a bubble will come up, and until the provider has reviewed that information. And the bubble will say something to the effect that, your findings are out there, they are finalized. However, your provider has not yet had a chance to examine them. I think that'll be helpful for patients. So those are a couple examples of something I've been able to change. And then one other plug I'm going to put in is I was able to, many years later, look at my own pathology report and my pathology slides by a caring provider at my health institution. And I learned so much about my cancer and it really changed what I was going to do moving forward, the information that I learned. And so that has become a passion of mine. And I'm working with the American Society for Clinical Pathologists and University of Michigan to promote what we're calling as pathology patient clinics. And this is kind of a new concept. And it is taking hold in little cottage industries around the country. Many other health institutions are providing this service, have provided this service, and it has been really, I think, helpful for patients. Many patients don't know that their pathologist is actually the person that diagnoses their disease. They think it's their surgeon, or they think it's their PCP, or they think it's their oncologist. No, it's the pathologist. So you can learn a lot from, in my opinion, from meeting with them, looking at your pathology slides, going through the report with the person that actually saw your disease for the first time. So that is a huge passion of mine, and I can talk for months and days about that. But we're making progress. I'll say that.
It's really exciting, and it sounds like a really powerful experience for you to be able to see normal tissue next to abnormal tissue and to put all those pieces together. Thank you so much for your work in this area. And thank you for being a guest on the podcast today. It's just been really great, and we appreciate so much you sharing your personal experience, your vantage point as a patient and advocate, and then your service work as well. You're really a testament to, you're a real asset to the field and a real partner in care. Thank you so much.
Again, thank you so much for the opportunity, and thank you for all the work that you're doing on behalf of patients.
It's wonderful to share a passion with you. Thank you.